Hello, everyone, and welcome back to VellTALK. I'm Dr. Kathy Turpin, and we're joined today by one of Kansas City's most well-respected sports medicine physicians, Dr. Michael Khadavi. Dr. Khadavi is a Stanford-trained sports medicine physician who specializes in physical medicine and rehabilitation. He's currently partner at Apex Orthopedics and Sports Medicine in Overland Park, Kansas, and also as a leader in regenerative medicine. He serves as a national educator and consultant, providing cutting-edge care to the community and to professional athletes alike. In fact, he currently serves as Sporting KC's team physician, as well as the Kansas City Ballet and the Swope Park Rangers. Dr. Khadavi is a well-known author, he's well-published, and he's currently the reviewer of multiple sports medicine journals. We are fortunate to have him here with us today, and we're also fortunate to hear about regenerative medicine as well as stem cell treatments. Welcome.
Thank you, Kathy. I'm happy to be here.
Good. How are you doing today? Good?
Great. Very good. Yeah.
Good to have you on this rainy day.
Yeah.
Why don't we start first in learning a little bit more about you? Tell us about your background as well as how you chose to get into this profession and a little bit about that profession, if you will.
Yeah, sure. Sports medicine is exciting for a lot of reasons. It's changing every day. And that's one of the things that excited me when I first started learning about sports medicine and what it is. When I was an athlete, I grew up here in Kansas City, played sports at Shawnee Mission South, and went to the University of Kansas where I played some club sports. I had a slew of injuries, and the musculoskeletal system, orthopedics, sports medicine was always very exciting to me. And so got me into med school and then into residency. And to me, the most exciting part of sports medicine was how do we fix injuries, real injuries, big injuries, without surgery. And the surgical side of things is very fascinating. It's very exciting, but fixing someone without a year-long recovery, Tommy John surgery, for example, has a year to a year and a half before a baseball pitcher's going to get back and be contributing to his team. And so this led up to my excitement with sports medicine and regenerative medicine. In fellowship at Stanford, one of the parts that I most enjoyed was seeing these professional athletes return after an injury in a lot of times half the time of what I was used to and what we would see a lot of recreational athletes. And a lot of that is just having a very diligent training staff, a very good medical staff. And now in Kansas City with sporting and the ballet, I see that happen every day with these athletes. They get back very quick just because they have to. It's their full-time job to rehabilitate and to rest and then get back on the field. But a lot of these treatments in the regenerative world, such as stem cell treatments, PRP treatments, have been offered to professional athletes for the last 15 or so years. And the last 5 years, they've really skyrocketed. And so my experience with professional athletes is how I started getting involved with the stem cell and other regenerative treatments like PRP in general, and something that has been very excited to be able to bring that back here in Kansas City.
Great. Yeah, you covered a couple topics I want to make sure that our audience is understanding. You use PRP. Can you give us a little bit more about what that really means, what it stands for, what that means for our audience?
Yeah, happy to. So first off, backing up a step, regenerative medicine alludes to any treatment that regenerates a tissue. And we're usually using our body's own cells, growth factors, and other enzymes like cytokines and chemical mediators. So the two that are the most widely used now within that realm are PRP, which stands for platelet-rich plasma, and the true stem cell treatment. There are a couple of these. The main one is bone marrow concentrate, where we draw someone's bone marrow from a bone and then concentrate that bone marrow. And we're able to take a 60 to 120 milliliter aspirate of bone marrow and then concentrate that to 1 or 2 milliliters of concentrated stem cells plus platelets and growth factors and some other proteins that will initiate and then continue the healing process. So that's what the bone marrow concentrate part is. The PRP, platelet-rich plasma, is a blood draw. We draw a certain amount of blood, between 15 and 120 milliliters of blood, and then put that through a centrifuge. And there are 2 different ways we can spin that, and we can really customize the different components within that. We can based on what the injury is, if it's a tendon versus a joint versus a ligament, the chronicity, we can increase the platelet concentration, we can change the white cell concentration, and this is where a lot of research is headed now, is if someone comes into my clinic and they have, I used the example earlier of a Tommy John surgery, they have an elbow injury from overuse, which is tear, partial or complete, of the ulnar collateral ligament of the elbow. A lot of people have heard of pitchers tearing that ligament, and for a lot of these high-grade tears, that's been an indication for surgery in the past, where now we can do either the platelet-rich plasma or the bone marrow concentrate stem cell procedure and get them back in 3 months without the need for surgery.
Terrific. We've talked, you've covered quite a bit in relationship to the current athlete, and I'm a former athlete, and so, at this point of the game for me, I'm looking for what I would be able to do now to become more active. So talk a little bit about kind of just the general population and how you're seeing former athletes coming back and saying, what can you do for me?
Right.
And how that process.
Right, yeah, so I see that a lot. The Kansas City has 2 physicians that are part of the NFL alumni network, and somehow I got myself on that list. And so those are very common injuries that we see. A lot of these are injuries that these guys suffered when they were in the NFL, and then a lot of these guys are 15 years, 20 years out, and just sort of have worn out joints that they want to continue to walk on, for the rest of their life. So the most common indication for any of the stem cell or PRP treatments that we do is osteoarthritis. Osteoarthritis being a wear and tear condition from either years of use or some trauma that happened in our past, like an ACL or a meniscus injury to our knees, that will take the cartilage volume within a joint from several millimeters, every joint's a little bit different, down to next to nothing. And so PRP and stem cell have various mechanisms that they work through. The main one, to be completely honest, is an anti-inflammatory mechanism. And they alleviate pain. They work through they upregulate your body's own cytokines and other proteins that signal pain relief, and then they inhibit those that cause pain. Some of the molecules that are the most well researched are transforming growth factor beta. Is a very powerful enzyme for the anabolic process, which means the growth process within a joint. On the other hand, we have an enzyme like interleukin beta, which is one of we consider bad guys, because it causes this big cascade of signals to break down cartilage and tendon within a joint or around a tendon. And so for the day-to-day things that I see in clinic, osteoarthritis is the most common, and these PRP and stem cell treatments work well. It's very important. Over the last 5 years, we've seen stem cell clinics pop up on, seems like, every street corner of an affluent neighborhood, and it's really important to be honest with ourselves what the research really does show, because in 2019, we're still at the tip of the iceberg. We are very much just at the beginning of our research within different stem cell treatments and PRP treatments. And I'm not going to take a joint, say this is a joint space, I'm not going to take a joint that looks like this and magically create the joint space again. That's not going to happen, but we can take a painful, swollen, inflamed joint and get it back to function and moving again.
Dr. Khadavi, thank you so much for sharing the first part of our two-part video. I look forward to continuing our discussion on stem cell treatments in part 2.
Thank you, Kathy. It's a pleasure to be here.